afternoon. Thank you for coming to this briefing. My name is Chris Smith. I represent a district in central New Jersey. I'm currently in my 16th term. And Mike Doyle is the co-chair along with me. In 2001, we formed the Autism Caucus, and we've been trying ever since to grow the knowledge base, and all of you being here, we're deeply appreciative of that, among council members as well as their staff, especially when it comes to appropriations and legislation designed to assist the autistic community, children, as well as their families. I'd like to very briefly, I, like many people here, when you get elected, you go out, you meet everything, and meet with people and find out what's going on in your own district. Well, very quickly after I got elected in 1980 and then took office in 81, I visited the Eden Institute, which is one of the premier, not just treatment centers, as well as group homes and the like for severely autistic individuals. I went to the group homes. Then we thought the prevalence of autism was about 3 out of every 10,000. And it was a very serious problem, but it seemed as if it was being taken care of by very specialized interventions like that which Eden Institute offered. In 1997 and into 1998, a husband and wife in my district in Brick, and for any staffers who are here, it's important, as we all know, to pay attention to casework. They came to my office and said, we think we have a prevalence spike in Brick, New Jersey. Will you be with us? I said, of course. We spent 3 hours in my office going over the data that they had assembled, a very, very good survey. And they were meeting with resistance from the Board of Education, from the town council, and from the mayor, because all of a sudden, Brick was getting the unsavory reputation of being a place where sickness seemed to prevail. There was already a concern about cancer clusters before that. So it was a place people might not want to move to. I got accused of, by having this meeting and then following it up with a number of meetings with interested parents, of hurting property values. So there was significant resistance. But when we asked the CDC and the ATSDR and our Board of Health to come in and look at this apparent prevalence spike, they did a study, an expert study that was extraordinary. They did data calls, obviously, from local communities that we heard about, and all of a sudden it became clear that it wasn't just Brick, but it seemed as if there was some game changer somewhere in the population causing this huge new increase in autism. I introduced the bill at the time, HR 274. We called it the Autism Statistics, Surveillance, Research, and Epidemiology Act of 1999. We had 199 co-sponsors. And even as the families and I and others tried to garner support for it, we were met with blank stares from people who said, autism? That's so rare, what are you doing this for? And then we went around and talked about the Brick study and the need. We got this attached to the Children's Health Act, which was a bill sponsored by Congressman Mike Bilirakis from Florida, who was chairman of the Health Committee of Energy and Commerce. And this was Title I. And all of a sudden, centers of excellence pursuant to this legislation were established, and CDC was off to the races doing its great work, as well as NIH, but in trying to determine what is truly going on. That led to, 5 years later, we had an Autism Act, and then the reauthorization that we just accomplished in early fall. The people that are behind the great work that is done, and there's always disagreements, I know, about what should be studied and to what extent and what may be a trigger. But we have with us today 3 extraordinary people who will give you the expert insights, especially pursuant to the most recent study that just came out. And I'll start with Dr. Marshalyn Yeargin-Allsopp. She's a Chief of Developmental Disabilities Branch for the National Center on Birth Defects and Developmental Disabilities at CDC. And we have a bio on her, which, for time purposes I won't read, but very, very accomplished person. Then Jon BAio, who is an epidemiologist and principal investigator for the Autism and Developmental Disabilities Monitoring Network, or ADDM, as we all know it as. And he too has a wonderful resume, and will speak. And then Dr. Andy Shih, who's the Vice President of Scientific Affairs for Autism Speaks. He too has done yeoman's work in combating autism And most recently, and for those who are interested, I chair the Global Health Africa Global Human Rights Committee. We held a hearing last year on this growing problem of autism all over the world. I was in Nigeria about 8 years ago, because I do a lot of human trafficking. I wrote 3 laws on human trafficking. And when I gave a big speech to a number of people on combating sex trafficking and labor trafficking, a man came up and he said, "What are you doing on autism?" I said, "I'm glad you mentioned it. Why do you ask?" We sat down, we had dinner, and he informed me that he felt that Nigeria may have as many as 1 million autistic individuals, and I met with his wife, who's a medical doctor, and we've been working with him and his NGO ever since. So we had a hearing last year, and as Dr. Shih did say in the hearing, there probably, this is an estimate of course, there may be 67 million autistic individuals globally. And as we heard, which is why what we do here is so extraordinarily important for what we do everywhere else, not just for our kids, but all kids. We had a woman from Cote d'Ivoire testify, who's now living in America, and said there's nothing available. No early intervention, none of it available in her country, former country of origin, Cote d'Ivoire. And we hear that from so many others, Nigeria, although it's building capacity. So again, the work that's done here will have an impact on our families, our kids who are afflicted by this disability, but also a global reach as well. So it's a privilege to have such extraordinary people here who are the real doers. So I'd like to, Doctor, who would like to go first?